So today we're working with a patient, Mike, who's 2 weeks post ACL reconstruction, and he's having some issues firing the quad on the surgery leg. So today we're going to use some E-stim to help get that muscular control and do a little bit of strengthening of the quad. Some contraindications for this would be any active cancer he would have if he was pregnant, if there is impaired mentation or cognition, where he wouldn't be able to tell me if things are hurting, if any impaired sensation around the area, and then if he had a pacemaker would be another contraindication. So we'll work with him here. All right, Mike, so today we're going to do something called neuromuscular electrical stimulation.
Okay.
So what that's going to help you with is we're going to help get some control on the quad, and we'll do some strengthening at the same time.
Okay.
Some of the contraindications for this are if you have active cancer, pregnancy, if you have a pacemaker, if you are unable to tell me if things aren't painful or not going right, and then if you have impaired sensation.
Okay.
Do you have any of those things, like the cancer, the pacemaker,
Nope.
pregnant? Nothing? So I'm just going to touch around a couple spots where I'm going to put them just to make sure you can feel that, okay?
Okay.
Can you feel that there?
Yep.
Can you feel that up there?
I can.
All right, what about over here?
Yep.
Okay, perfect. So I'm going to roll up your shorts just a little bit.
Okay.
And if at any point things feel, it shouldn't be painful, you'll just feel a little tingle, and then we'll get into a muscle contraction.
Okay.
If things feel painful, or if you want to stop, you just let me know, okay?
Okay.
Set those up there. I'll get this a little higher so it can get nice and deep in the muscle. Alright, and then the parameters that we'll set for Mike today, we're going to do a biphasic, biphasic pulse current. So we'll have that at normal just because we're working one muscle, not both sides. We're going to turn up the duty cycle to 1050 because this is his first time. We want to give the muscle time to rest in between. And then the ramp will get up to 2 just so he doesn't get right into a strong contraction. He kind of builds up and it's a little more comfortable for the patient. In terms of time, we're going to go, normally I think we would do, 16 minutes or maybe 10 to 20 is kind of where we want. Maybe we'll start with 10 for his first one so we get 10 strong contractions, and then we'll build up as we go. For the rate, we're going to have a 50. We're trying to get that tetanic contraction. And then pulse width, we'll start at 200. If it's hard to get him into a contraction there, we might bump that up maybe 250 or 300 so we can lower the intensity a little bit. But we'll start at 200 for this one. And just for this video, we're going to do just a minute, okay? Just to kind of keep this quick. So I have all of my parameters set. And now the next thing that we'll do, I'll make sure Mike is ready. Are you ready to go here?
Yeah.
All right. And then we'll just start to increase the frequency here. So at first you'll feel a little tingle. So if you want to just let me know how things are feeling as we go.
Okay, I'm starting to feel a tingle.
A tingle there, okay. And we're looking for maybe like a 50% contraction.
Okay. Yeah, about right
So
there.
it'll start to twitch a little bit. Does that feel pretty strong there?
Yeah.
All right.
Yeah, I'd say right there's good.
So let's start. And it'll have you contract for 10 seconds, and it'll slowly ramp down. And we'll rest for about a minute, and then it'll come back up again, okay?
Okay.
How'd that first round feel? Did that feel okay?
That felt good, yeah.
I'm just going to stop it because nothing else will happen. All right, Mike, nice work today. How'd that feel for you? Feel kind of nice to get a little contraction going?
Yeah, it was good.
All right. So next time I think we're going to change things a little bit, and we'll just put you on a little bit longer and maybe change your rest time in between so we can keep on strengthening you, okay?
Okay.
Alrighty. And let me just check underneath the skin. Skin still looks good, so I think we're good to go.
Awesome. Thank you.